Health and Wellness Tune-Up series. This will be a safe place to learn, grow, and reset. During this time, we'll explore common mental health challenges and conditions such as seasonal affective disorder, depression, anxiety, and mood disorders. And we will also use these tools to help strengthen your self care as well. So, what you're going to gain during these short presentations is recognize signs and symptoms of common mental health conditions, learn practical coping skills and treatment options, discover self care strategies to recharge your mind as well as your spirit, and hopefully, you're going to leave each session feeling refreshed and renewed because even the strongest of engines need a little maintenance. So, let's embrace this season of change together. So let's talk a little bit about seasonal affective disorder, also known as SAD. It's a type of depression that occurs during a certain time of the year, and it's mostly during the fall and winter months. And this is when the time changes, so our daylight hours are a lot shorter. But despite common belief, you can also experience seasonal affective disorder during other times of the seasons. So you may experience this during the spring as well as the summer. Now, the symptoms are a little bit different depending on which season you fall in. But when we're talking about the summer patterns, we're looking at different symptoms such as restlessness, anxiety, trouble sleeping, may have decreased appetite. Rather than the oversleeping, increased craving of carbohydrates that's often seen more so in the winter months. So now let's look at what happens in the brain when we're thinking about seasonal affective disorder. So it happens when we have a reduction in our daylight time exposure. And what happens is this then changes the brain chemistry. So when you have less sunlight, this lowers your serotonin. And serotonin is a chemical in the brain that affects mood and sleep. And so, by you having this reduction of light and serotonin, it's going to change your mood. Now, whenever we have this shift in our daylight savings, it also causes your body to produce more melatonin. Well, melatonin is what induces sleepiness. And so, when we flip to our fall and winter months, because we have less daylight, then we have more melatonin, which then means we're more tired. But also, when we flip to the fall and winter months, our vitamin D levels are lower. You have to think about it. Less sunlight, it's cold, it's cool, so we're not outside as much as we were in the summer and spring months. And when you have lower vitamin D level, this also means less serotonin support as well. So, what does this all mean? Well, the circadian rhythms then get out of sync. That's your sleep wake cycle. And then all of these things combine to create the perfect storm, which thus creates seasonal depressive disorder. And again, mostly during the fall and winter months is when these things are then experienced. So when we look at this little diagram here, again, looking at what happens in the brain. So the reduced sunlight changes the chemicals in the brain. So we talked about the days are shorter. Therefore, that means that we don't have as much natural light that enters the eyes. And then we're going to experience the serotonin. That's going to drop. And again, serotonin supports overall well being, less sunlight, less serotonin activities. This can then trigger depression and fatigue. We talked about the melatonin increasing, causing more sleepiness, the lack of vitamin D. Again, affects your mood, and then the disruption in the circadian rhythms. And so, all of this plays a role when we're looking at serotonin activities and low vitamin D. So for those of you who are visual people like me, is a visual diagram of talking about all those things that happens when the seasons change. Now, looking at the symptoms of seasonal affective disorder, one may experience persistent low mood or sadness. You might experience a loss of interest or activities and things that you like to do. You're just not as interested anymore. You may experience fatigue or low energy, may have changes in your appetite. Sometimes you might start craving carbs and sweets. You might experience some difficulty concentrating, difficulty staying focused, and then you might have some sleep disturbances. It could be too much or it could be too little. And then you also may start feeling hopeless or withdrawn. Now, if you looked at these symptoms and said, this sounds a lot like depression, you're absolutely correct. However, when you're looking at seasonal affective disorder, it's occurring during the certain times of each year, unlike depression that can be present at any time. So, how do we treat seasonal affective disorder? One thing that we can do is expose ourselves to light therapy. They have these wonderful light boxes that you can buy that then mimics the sun, more sunlight, more serotonin, and that can regulate your mood. What's also important during this time is that one stays active. You know, they say if endorphins were a drug, they would be the most powerful drug in the world. So then, how do you increase endorphins? By staying active, whatever that looks like for you. Not saying you have to go out here and participate in a 5K. It may be brisk walks, it may be doing yoga, it may be swimming, whatever that looks like for you. The key is that you're staying active. And then you're also having balanced meals, avoiding excess sugar, excess processed foods, because those things can all play a part in your mood as well. So plenty of fiber, plenty of fruits, plenty of vegetables. And then your good healthy meats, fish, and things like that. And then also staying connected, mind body practices. That may be meditation, that may be mindfulness, that may be deep breathing, reducing stress, and that's your mind body practice. So, staying connected to yourself, but also staying connected to other people, being social, getting out. If you have friends that invite you out, no matter if you're like, oh, I really want to stay in, try to press through, go out, enjoy yourself. Don't stay cooped up. That doesn't help in the end. And try to avoid isolation. And then, sometimes we do have to seek professional help. This may be in the form of therapy or could also be medication management, which takes us to some medication considerations. Now, before I go into a lot of detail about medication considerations, what I want you to be mindful of is that anytime we're talking about medications, this should be done under the supervision of a licensed professional. In no way, shape, or form am I giving you any direction or guidance to go try any of these particular medications. I'm just more so informing you of how this would be treated. So, when we think about seasonal affective disorder, depression, the first line treatment for symptoms that are moderate to severe may be in the form of therapy and lifestyle changes. However, sometimes that's just not enough. And sometimes medication is required. Now, I'm not one to push medications on anybody. I think sometimes they're indicated and sometimes they're not. And that's something that you and your provider can talk a little bit more about. My job is to just let you know what the options could be. So, some common options would be SSRIs, that's selective serotonin reuptake inhibitors. So, remember, we talked earlier about when we think about seasonal affective disorder, we talked about low serotonin. So, by giving these selective serotonin reuptake inhibitors, also known as SSRIs, it's then going to increase the amount of serotonin. So, some examples of that would be sertraline, also called Zoloft, fluoxetine, Prozac, paroxetine, also called Paxil, citalopram, Celexa, and escitalopram, also Lexapro. All examples of SSRIs. And then another example would be SNRIs. So the difference here is that you have norepinephrine also on board. And so examples of that would be venlafaxine, also called Effexor, duloxetine, also called Cymbalta. And then we have one of my favorite medications, which is Wellbutrin, and it's actually FDA approved for seasonal affective disorder. Typically, if someone's going to take Wellbutrin, it's often prescribed in the early fall months before the symptoms begin. And they work a little differently than the SSRIs and the SNRIs because they're affecting dopamine and norepinephrine. I also use Wellbutrin because I tell people it's my motivation medication, my get up and go. So for someone who's just not motivated to do much of anything and they're not having as much as anxiety, then I would prescribe Wellbutrin for that. Again, my own personal thoughts. Your separate provider may have a different opinion about that. And then we might have some add ons or alternative therapies. So it may be that melatonin may be recommended, especially for those people who are having trouble sleeping. Melatonin is going to help regulate those sleep cycles because in seasonal affective disorder, that's pretty much what's disrupted. You might be asked to add a vitamin D supplement because of that vitamin D deficiency. So that may also help in those months. St. John's wort is also an herbal option. However, this medication can interact with a lot of other medications, so it's definitely important that you consult a provider before you add this herbal over the counter medication to anything else that you might be taking. Now, when we think about medications, what's important to know is that the choice of medication, it may depend on the symptom profile. It also may depend on one's medical history and their tolerance to medications. So if you think back when I mentioned Wellbutrin and I talked about if a person doesn't have anxiety, it's not that you can't use Wellbutrin in someone who has anxiety. You would just want to be aware of that because Wellbutrin can be activating. And so it could cause more anxiety. Another important thing to remember is that some of these medications could take 4 to 6 weeks before someone may feel the benefit of the medications. So that's why you will often hear me talk about therapy medications, they go hand in hand. And then again, sometimes you will have the non pharmacological, so the light therapy we talked about, staying active. We may combine that with medications to then have the best results. Again, I'm going to stress the importance is that medications should always be prescribed by and monitored by a healthcare professional. Now, if you're someone who you've watched this presentation and you've thought to yourself, a lot of that really sounds like some things that I go through a couple times a year. Then, if you want to schedule an appointment, feel free to scan this QR code. Um, you can also find me on Psychology Today. Happy to do a 15-minute consult just to see if working together could be an option. Or if you have any questions, feel free to reach out. So, again, this was our part one of a part four series. Be sure to check in next month whenever we talk about depression. Thank you for your time and your attention. I hope you found this information very valuable and tune in for the next session. Take care.